This content is not designed for use as a medical reference to diagnose, treat, or prevent medical illnesses or trauma. If you have questions about the diagnosis, treatment, or prevention of a medical condition or illness, please consult your personal physician.
Hi everyone. In today's lecture, we're going to talk about attention deficit hyperactivity disorder, also known as ADHD. I want to start by telling you about a boy named Gary. Gary is 10 years old and exhibits a variety of problem behaviors both at school and at home. On the bus to and from school, he can't seem to sit still and often switches from seat to seat so he can talk to all of his friends. His backpack is disorganized, and many times he forgets to do his homework. He has a hard time staying on task in the classroom, and he'll click his pen during class, which is distracting to both his classmates and his teacher. He continues to do so even when he's asked to stop. He also gets yelled at a lot by his teachers throughout the day for not paying attention. When he gets home from school, Gary is supposed to complete his chores and homework. However, he often struggles with both remembering this information and following through with it. This gets him in trouble with his parents, who often complain that no matter what they do or say, Gary's behavior doesn't seem to change. Gary also tells his parents that he's doing pretty well in school, but when they talk to his teachers, they find that he exaggerates a bit. His parents have also noticed that transitions are difficult for Gary and that it's nearly impossible to do anything relaxing with him. He has trouble sustaining attention even for short periods of time, so even watching TV makes him restless. Although many of these behaviors can be seen in all children during different periods of their lives, in children with ADHD, these behaviors are constant and resistant to change, creating significant problems both at home and in school. These problems even play out in simple day-to-day activities. Gary was diagnosed with a mild form of ADHD at age 6 and exhibits symptoms that are very common among children with this disorder. But what else exactly do we know about ADHD? ADHD affects approximately 2.2% of all children worldwide, with males receiving a diagnosis more frequently than females, and more than 75% of diagnosed children continue to exhibit significant problems into adulthood. One symptom, hyperactivity, generally improves during the teenage years, but other symptoms such as inattention, disorganization, and poor impulse control continue into adulthood. Individuals with ADHD can be very successful in life. However, without identification and proper treatment, the disorder can have serious consequences, including school failure, family stress and disruption, depression, relationship problems, substance abuse, delinquency, accidental injuries, and trouble maintaining a job. So early diagnosis and treatment are extremely important contributors to success later on. Medical science first documented children exhibiting inattentiveness, impulsivity, and hyperactivity back in 1902. Since that time, this group of symptoms has been given numerous names, including minimal brain dysfunction, hyperkinetic reaction of childhood, and attention deficit disorder with or without hyperactivity. The most current version of the Diagnostic and Statistical Manual for Mental Disorders, DSM-5, breaks ADHD into 3 different categories. The first category is inattention. Note that in previous versions of the DSM, This was listed as a separate disorder known as ADD, Attention Deficit Disorder. ADD now falls under the larger umbrella of ADHD. People with ADD have difficulty with sustained attention. Some of the behaviors they might exhibit include needing things to be repeated multiple times before fully understanding them, or appearing spaced out when someone is talking to them. They also may be forgetful, needing reminders throughout the day to complete daily tasks like chores. They may also lose things like homework assignments, books, keys, and so on, and may be easily distracted by extraneous stimuli. So, for example, if you're trying to have a conversation with someone who has ADD and the television is on in the background, they may become easily distracted by the TV. Those with ADD may also have trouble with organization, exhibiting poor time management skills, failing to meet deadlines, or failing to keep belongings organized. Do you recognize any of these symptoms in our opening description of Gary? Yes, right? Remember, Gary would do things like forget to do his homework and chores after school, keep a disorganized backpack, and so on. So he definitely exhibited symptoms of inattention. To be diagnosed with this form of ADHD, a person must exhibit several of these symptoms for a period of at least 6 months. The symptoms must be inconsistent with their developmental level, and they must negatively impact the person's social and/or academic activities. The second category of ADHD is called hyperactive and impulsive. To be diagnosed with this type of ADHD, the person must also exhibit symptoms for at least 6 months or longer, and the symptoms must negatively impact their life. Individuals with this type of ADHD may exhibit symptoms such as the inability to sit still or a tendency to fidget with their hands or feet. They might also be unable to engage in leisure activities quietly or talk excessively. In addition, they might appear to be always on the go. They may have difficulty waiting their turn. They may interrupt others when they are engaged in conversation or activities, and they may blurt out answers before a question has been completed. Gary exhibited some of these symptoms too. Remember how he would click his pen during class or be restless when watching television? He definitely showed symptoms of hyperactivity and impulsiveness. The third and final category of ADHD is a combined presentation of the first two types. In this case, a person would show symptoms of inattention as well as symptoms of hyperactivity and impulsivity. This is the type of ADHD Gary was diagnosed with. In addition to identifying the specific type of ADHD a person exhibits, criteria put forth by the DSM-5 also require professionals who diagnose ADHD to include the severity of the disorder as either mild, moderate, or severe. Someone with mild ADHD would only exhibit a few of the symptoms specified in the DSM, and symptoms would only result in minor impairments in the individual's social, school, or work settings. At the severe level, the individual with ADHD would exhibit many symptoms beyond the number needed to make the diagnosis, with several being severe or associated with marked impairments in social, school, or work settings. Someone with moderate ADHD would have symptoms or functional impairment that fall between the mild and the severe levels. There is no single test to diagnose ADHD. Rather, a comprehensive evaluation is necessary to establish a diagnosis, rule out other causes, and determine the presence or absence of coexisting conditions. Such an evaluation requires time and effort and should include a careful history and a clinical assessment of the individual's academic, social, and emotional functioning, as well as their developmental level. To receive a diagnosis of ADHD, a person's symptoms must be present before the age of 12. Adults who exhibit symptoms associated with ADHD but never received an official diagnosis as children can still be diagnosed, though if they are able to demonstrate that they first experienced symptoms before they were 12. Several types of professionals can diagnose ADHD, including clinical psychologists, clinical social workers, nurse practitioners, neurologists, psychiatrists, and pediatricians. Regardless of who does the evaluation, the use of DSM-5 diagnostic criteria for ADHD is necessary to obtain an accurate diagnosis. Keep in mind, though, that sometimes individuals can have more than one diagnosis, which complicates matters. So, for example, a child might be diagnosed with ADHD and depression, or ADHD and a learning disability. Other times, individuals who have ADHD are misdiagnosed because symptoms of ADHD can overlap with those of other disorders. Some of the most common misdiagnoses include conduct disorders, anxiety, depression, Tourette's syndrome, substance abuse, and autism spectrum disorders. This is one reason why it is important to not diagnose someone at first glance, but to examine them over time and at different time periods to see how their symptoms develop and change. Rushing to obtain a diagnosis is not beneficial to anyone and can, in fact, make the situation worse. Although nobody really knows what causes ADHD, researchers have been able to identify some potential risk factors associated with its development. Most likely, ADHD results from a combination of factors that interact with and influence one another. Trying to separate out these factors to determine how they contribute to the onset of a disorder is a nearly impossible task. At best, we can only speculate as to what factors may lead to the onset of a disorder. Even then, though, we don't know whether it is the factors themselves that contribute to the cause of the disorder, or whether there are secondary hidden factors that we are failing to consider. Here's an example. Did you know that there is a positive relationship or correlation between the amount of ice cream consumed and the number of violent crimes that are committed? Yep, they're related. As one increases, the other increases. Does one really influence the other, though? Or is there some secondary hidden factor that we are failing to take into account here? What about the heat of summer? When it's hot out, people tend to eat more ice cream. And believe it or not, the number of violent crimes increases during the hot summer months. You see what I mean? We need to be very careful when we start talking about factors and whether or not they contribute to the causes of a disorder like ADHD. Keeping this in mind, let's examine some factors that might be related to ADHD. It's believed that both genetic and environmental factors contribute to the onset of ADHD. Though many candidate genes have been examined, unfortunately, none of them currently have any predictive value, nor do they highlight any novel biological mechanisms. And so the search continues. We do, however, see an increased incidence of ADHD with biological relatives. So it's likely that genetic factors contribute to the onset of the disorder. More than likely, though, genetic factors in and of themselves do not cause ADHD. Instead, environmental risk factors trigger certain genes, which then leads to the onset of the disorder. So what are some of these environmental risk factors? One category is prenatal and perinatal risk factors. including such things as maternal smoking, maternal substance abuse, including alcohol, maternal stress, the baby being born with a low birth weight, or premature birth. Though these factors have not been scientifically shown to cause ADHD, they may be one piece of a larger puzzle that contributes to its development. A second category involves a person's exposure to environmental toxins. The most widely studied toxins in this regard include organophosphate pesticides, biphenyls, and lead. Although these are viewed as potential risks, it is unclear for how long or at what developmental period the exposure needs to take place to maximize this risk. A third category is dietary factors. These include things like nutritional deficiencies such as zinc, magnesium, and polyunsaturated fatty acids, nutritional surpluses like artificial food colorings, and foods low or high in immunoglobulin G. The final category is psychosocial adversity and includes things such as family dysfunction and low socioeconomic status, conflict including parent-child hostility, and severe early deprivation. None of these environmental factors have been shown to be causal, so we cannot say, for example, that exposure to lead causes ADHD. Rather, we can only say that exposure to lead could potentially increase a person's risk of getting ADHD because a correlation has been found between the two factors. A variety of neuropsychological deficits have been tied to ADHD, but not everyone with the disorder exhibits them. Some individuals display a single deficit, some multiple deficits, and still others, none at all. So there is a huge range of individual variability. I'm going to focus here on some of the neuropsychological deficits that seem to be fairly common across multiple individuals with ADHD. These include impulsivity and problems with planning, inattention, hyperactivity, problems modulating gratification, and trouble with emotional regulation. Let's look at these one at a time, starting with impulsivity and problems with planning. Impulsiveness directly leads to problems with planning. If you think about it, planning requires the ability to inhibit an action while thinking through the best ways to obtain a goal and then executing and monitoring that plan. Here's an example. Let's say I wanted to go outside and do some yard work. Let's say pull some weeds. If I were acting on impulse, I might just go outside and start pulling weeds at various locations throughout my yard without putting on sunscreen first, without the proper clothes or gloves, and without a plan to make sure my time spent outside is efficient. If I resist this impulsivity, however, I can think through the best method by which to accomplish this task. In this case, I would dress properly, put on sunscreen, gather my gardening tools, and move methodically through the yard as I weed. I would also be able to monitor and change my plan if necessary. For example, if it started raining, I could delay my yard work, or perhaps work in a region that is not affected much by the rain. In other words, I could shift my thinking about my plan, and I could be cognitively flexible when it comes to executing that plan. Someone with ADHD would have great difficulty doing this. A second neuropsychological deficit is inattention. In particular, difficulty with sustained attention. If I asked you to sit and work on a puzzle for 30 minutes straight without stopping, could you do it? If so, you are able to maintain sustained attention on a task. If, however, you keep needing to get up and walk around, you fidget in your seat, you daydream, and you can't seem to stay on task, then you might have problems with sustained attention. This type of deficit also relates to our ability to function efficiently. If you can't stay on task, it will take you longer to get things done. What about hyperactivity? This is when someone is excessively restless and overactive, someone who fidgets quite a bit. This obviously can lead to issues trying to complete tasks in a timely manner. A fourth deficit involves problems modulating gratification. What in the world does that mean? It means that individuals with ADHD are driven toward immediate, frequent, predictable, and meaningful forms of gratification. At the same time, they have great difficulty working toward a long-term goal. If, for example, a child with ADHD really wants to buy a toy that costs $20, and I give them $10 with a promise that I will give them another $10 in a week so that they can buy the $20 toy, they would more than likely spend the $10 right away to get the immediate reward rather than wait a week for me to give them another $10. This holds true even in older children with ADHD who have learned the value of money and the benefits that come from saving it. One way researchers have examined delayed gratification in children is through the famous marshmallow experiment, first conducted at Stanford in the 1970s. Here, children are offered a choice of receiving one marshmallow immediately or 2 marshmallows if they wait 15 minutes. During the wait time, the single marshmallow is placed in front of the child on a table, and the researcher leaves the room. Children who can delay their gratification to receive the 2 marshmallows have been found to distract themselves by refusing to look at the marshmallow, singing, laying their head down on the table, etc. Children with ADHD have a lot of difficulty averting their attention away from the treat and thus usually fail the test. The final deficit relates to emotional regulation or lack thereof. Individuals with ADHD appear to be on a roller coaster ride of emotions. When they are happy, they are so happy that it disrupts the people around them. When they are unhappy, they are so unhappy that people are equally disrupted. They operate at the extremes, often going from one to the other. If you think about it, these neuropsychological abilities affect multiple aspects of our lives, whether it be family, social, academic, or vocational. When these abilities are intact, we perform in a consistent, predictable, independent, and efficient manner. Failure to use and develop these abilities, however, leads to unpredictable behavior and inconsistency, which affects every aspect of our lives. Researchers have shown through a variety of studies that multiple areas and pathways in the brain are affected by ADHD. Some of the major brain areas involved include the frontal lobes, basal ganglia system, and the cerebellum. Reductions in cortical volume have been identified in these regions, and these brain areas also form brain circuits, so connections of neurons from different brain regions that subserve particular brain functions. 4 of these circuits have been implicated in the neuropathology underlying ADHD. The first is called the frontostriate thalamic circuit. This circuit has bidirectional interconnections between the prefrontal and parietal cortices, the basal ganglia system, and various nuclei in the thalamus. It's believed that this circuit mediates abilities such as working memory, response inhibition, and sustained attention. The second circuit, called the corticocerebellar circuit, focuses on the cerebellum and its projections to the prefrontal cortex, cingulate gyrus, and some parietal regions. This circuit is involved with analyzing information about the temporal structure of the environment. Damage to the circuit would result in errors related to time estimation, such as how long we think it is going to take us to do something, and perception. The third circuit involves connections between the ventral portion of the striatum in the basal ganglia system and the orbital frontal cortex in the frontal lobes. It's believed that damage to this circuit is associated with an inversion to delayed reinforcement. In other words, people who have damage to this circuit will accept an immediate reward, but not a delayed one. Think back to the example where the child spent a small amount of money right away rather than saving it to buy something more expensive. The last circuit involves connections between the amygdala, the prefrontal cortex, and the orbital frontal cortex. This circuit is believed to be involved in the regulation of our emotions. Damage to this circuit could result in the roller coaster ride of emotions often noted in individuals with ADHD. There are 4 basic categories of treatment for people with ADHD: medication, therapy, education and training, and school-based programs. Keep in mind that many individuals benefit from involvement in all 4 of these categories at the same time. Let's start by looking at medication. The first line of treatment, medication-wise, for individuals with ADHD is stimulants. You might be thinking, why would anyone give a stimulant to someone who is hyperactive? Believe it or not, they are pretty effective in reducing hyperactivity and impulsivity and improving one's ability to focus, work, and learn. But how? Stimulants tend to increase the neurotransmitter dopamine, which contributes to the ability of our frontal lobes to function properly. Commonly prescribed stimulants include Ritalin, Concerta, Vyvanse, and Adderall, although there are others. If a person with ADHD has difficulty taking stimulants, maybe they cause bothersome side effects, non-stimulants may be a helpful alternative. In general, these medications take longer to start working than stimulants, but have been shown to improve focus, attention, and impulsivity in a person with ADHD, either by boosting the neurotransmitter norepinephrine, as the drug atomoxetine does, or by stimulating activity in adrenergic receptors, as is the case with the drug guanfacine. Keep in mind that there are many different types and brands of medications, each with their own potential side effects and benefits. Sometimes different medications, different dosages, or even different combinations of medications are needed to find out what works best for each individual. Obviously, a person would need to be closely monitored by their prescribing doctor to determine this. A second category of potential treatment is behavioral therapy. Research suggests that behavioral therapy works best by helping patients and their families learn how to better cope with daily challenges and struggles, rather than directly changing ADHD symptoms per se. For example, for children and teens, the therapist might work with parents and teachers to help the individual keep a routine, organize items, and reward them when they are successful at doing these things. For adults, therapists might provide them with tools to help organize their life, keep routines, and break large tasks into smaller, more manageable ones. This idea of teaching families and teachers how to help children with ADHD is also relevant to the next category, education and training. Research shows that in order to reach their full potential and succeed, children and adults with ADHD need guidance and support from their families and their teachers. Education and training includes 1, teaching parents the skills they need to encourage and reward positive behaviors in their children. 2, sharing stress management techniques with parents so they can deal better with their own frustrations and, by extension, with their child's behavior. And 3, having parents and families join support groups so they can connect with others who are dealing with similar situations. The last category is school-based programs. Some schools offer special education services to children with ADHD who qualify. Here, education specialists can help make changes to classroom and homework assignments in order to help the child succeed. In sum, medication, as well as a variety of support services to help not only the person with ADHD, but also their families, are known to benefit individuals with ADHD and maximize their best chances for success. We've covered quite a bit in this lecture, and I hope you now have a better understanding of ADHD. Join us in our next lecture as we examine another disorder that is frequently diagnosed in childhood, developmental dyslexia. Bye for now.